Hey guys, Samantha here, and I'm here to help you feel good in your own skin. So today we're going to be discussing the two main types of acne, which are hormonal acne and bacterial acne. So by the end of this video, you are supposed to know what is hormonal acne, what is bacterial acne, how to differentiate these two, and how to treat each one of them. So ultimately, you should know which one of them you're suffering from before you start looking for a cure for something you do not know how to cure. So if that is something you would like to know, please stay tuned, get your glass of water, get a pen and paper, and let's get into it. So we are going to start with hormonal acne. What is hormonal acne? This is acne that is caused by an imbalance of hormones inside your body, inside your bloodstream. So this, as a result, causes you to have acne, right? An imbalance of hormones in your bloodstream causes you to have clogged pores, causes you to produce a lot of oil, your skin to produce too much oil. So that excess oil causes your pores to be clogged, ending up resulting in an acne breakout. So because of hormonal imbalance, you have excess oil production, which in turn causes an acne breakout. So how to identify this hormonal acne? For you to know if you have hormonal acne or if you have bacterial acne, right? Hormonal imbalance causes other signs and symptoms. For example, facial hair. If you have hormonal imbalance, you most probably have facial hair. You most probably have irregular periods. You most probably suffer from ovarian cysts and things like that. So if you're suffering from all those other symptoms that I've talked about, and you also have acne, it probably means your acne is hormonal. Right. Hormonal acne mainly comes out on your jawline, on your forehead, on your chest, on your back. So most times, if you have hormonal imbalance, you have acne on your chest, you have acne on your back, you have acne on your jawline, not all over your face. You have acne on your jawline mostly. I'm going to insert a picture of what I'm talking about in the areas that are mostly affected by hormonal acne. All right. So we've discussed what is hormonal acne, how to identify it, and now we want to move on to how to treat it. So because it is caused by an imbalance of hormones inside your body, inside your bloodstream, it means it needs to be treated from inside, not from outside. Topical treatments may work, but you need to get to the root of the problem, which is inside your bloodstream. So you need to take an oral treatment, whether it is contraceptive pills, for example, Diane 35, that you use to balance your hormones. You can take supplements such as evening primrose oil. They are known to cause to balance hormones. You can take in extreme cases, that's when you are put on Accutane or isotretinoin to balance your hormones so that the acne stops coming out. So this is how you identify hormonal acne and how you treat it. Right. We move on to bacterial acne. So bacterial acne is acne that is caused by too much bacteria that is just sitting on the surface of your skin. It has nothing to do with what is inside you. So it's mainly caused by just a buildup of dirt on your skin. You're probably sleeping on dirty pillowcases. You are probably not washing your face or your skin enough. You are not changing your clothes after going to the gym and sweating. You are just in a dusty environment, things like that. So because of this buildup of bacteria, when that bacteria sits on your skin, it causes you to break out. That bacteria as well, when it mixes with the oil on your skin, it is going to clog your pores and cause you to break out as well. So to identify bacterial acne, it mainly shows up all over your face. It doesn't choose your jawline or anything. It shows up everywhere on your face. If it's on your chest, on your back, it just comes out. It doesn't have a specific area, right? So to treat bacterial acne, you can treat it topically. Like I said, it's caused by bacteria. So one, you can treat it using antibiotics, right? That is the internal treatment. You can take antibiotics for it. But however, you can use topical treatments. It is mostly cleared by topical treatments. For example, getting a face wash with benzoyl peroxide, which is going to kill the bacteria that is on your skin, right? And changing your sheets regularly, changing your pillowcases regularly, making sure when you go to the gym, you just come back, you make sure you cleanse your skin, you don't leave sweat to build up or to mix with the oils on your skin. Like I said, you need to differentiate between hormonal acne and bacterial acne before you start looking for a treatment. Because, for example, you are suffering from hormonal imbalance, you have acne on your face, on your jawline, wherever you have acne. Then you go and take a topical treatment for bacteria. Then you use the topical treatment to treat hormonal acne. Then it is not going to work, right? Then you take a treatment for hormonal imbalance. You take contraceptive pills to balance hormones, but then you are suffering from bacterial acne. So it is not going to work. So you need to know which one of the types of acne that you are suffering from. If it's bacterial, then you choose the right treatment for it. If it's hormonal, then you choose the right treatment for it. At this point, I am going to pose a question to you if you're suffering from acne, to ask that from what we have discussed, do you know which type of acne you're suffering from? Have you been using the right treatment? If not, please leave a comment in the comment section. Let us discuss, let us talk about your symptoms so that we know which type of acne you're suffering from. However, if you use any topical treatments, if you use any oral treatments and they do not work for 3 months, then you need to visit a dermatologist so that they do some blood tests on you to know if you have hormonal imbalance or to know if your acne is caused by bacteria. Please do note that I am not a dermatologist. I am just saying all this based on my research and based on what I've experienced. I suffered from acne since I was a teenager up to a few years back when I really discovered what was causing my acne. So I'm gonna insert my before pictures. I had body acne, I had facial acne. I'm gonna insert my before pictures so that you can see where I am coming from and where I am right now. All right, so this video was just for you to know the difference between hormonal and bacterial acne, how to identify it, and for you to identify which one you're suffering from. So let's meet in the next video where we discuss in detail how to deal with hormonal acne, how to deal with bacterial acne, knowing that you now know which one you're suffering from. Thank you so much for watching. If you've watched up to this point, please do subscribe, like, and share, and leave a comment, even if it's an emoji. Bye.